Welcome back to Healthcare Sucks, the not so gabby edition. Yeah, I gabbed on the last one. Uh, I hope you at least thought about it, because I did before I said it. I usually do. Okay, with that, I told you I wouldn't be gabbing. Let's jump right into this and see what the hell is going on in Dodge. I'm joking. Well, I'm not joking about what's going on in Dodge, but the hell. Because we're not in hell yet, even though some people might think they're in hell. I told you I wouldn't gab. All right, 2 cents worth. I live in Oregon, so it rains. So for me, and this is what I do. I'm prepared. I got so much work. I'll send you guys. I'll do a list as I go. It's nuts. All the things I can do in the next few weeks. Notice I said weeks. Oh, I know. I'm not candy coating you guys. It's weeks is what it is. Listen to this, and you'll know what I'm saying.
Cuomo has extended his states, telling them to refrain from any non-essential domestic travel for 2 weeks. Governors were given full discretion over the new rollout and said the advisory is already practically in place.
Totally consistent with everything we're doing.
That's something that, as I say, it's de facto happening already.
With roughly 42% of coronavirus deaths in the U.S. centered in New York, Governor Andrew Cuomo has extended his state's stay-at-home order through April 15th, stretching into major holidays like Easter and Passover. Coronavirus testing is expected to make a big leap forward this week as a new test will be released that can give results in as little as 5 minutes. The FDA gave the okay to Abbott Labs to roll out these tests, but it's based on technology which goes back to the early 2000s. King 5's Amy Marino talked with one of the men involved in that groundbreaking research.
It could be a game changer in fighting the coronavirus, a test with results in just a matter of minutes.
It should be a very sensitive and very rapid and accurate test.
Dr. David Gallus with the Pacific Northwest Research Institute is quite familiar with the test, which identifies a portion of the virus's RNA in the sample. It's not really cutting-edge technology. Gallus helped develop the concepts in a California research lab about 20 years ago. At the time, they were working with a grant to try and detect substances that might be used in bioterrorism, like anthrax.
And funding new and novel and things well before their time is really important.
Eventually, they sold the technology to another lab who was then taken over by Abbott, who is producing the rapid test and hopes to deliver 50,000 to medical providers every day. Results don't require a traditional lab setting. It uses these small boxes about the size of a toaster. They've already been testing for illnesses like the flu and strep throat for years. Now it will be able to give a positive result for coronavirus in about 5 minutes and a negative result in just under 15. Dr. Gallus says beyond worried patients, it could be critical for researchers.
To understand the way in which the virus spreads and to be able to model and understand what's going to happen, we need data, and you need a lot of data. And the United States has been way behind on getting enough data.
Dr. Gallus says it's gratifying to see the work become another tool in fighting the pandemic, but also highlights how important it is for society to support research before it's needed.
They were particularly interested in this bioterrorism issue, but it could have been funded from, and it could have been supported for entirely other reasons. But it was really the basic work that was supported that really made the difference.
Amy Marino, King 5 News.
A live look now at the Clink, where the Army has begun the transformation of CenturyLink Field Events Center into a hospital. And that hospital will be used for treating patients who do not have coronavirus. But the goal of this hospital is to help take the pressure off the state's healthcare system as the number of coronavirus cases continues to rise. 300 soldiers will help create this fully functioning hospital with nearly 150 beds, surgeons, even an on-site pharmacy. Supplies are already on their way there. At an on-site news conference yesterday, the governor applauded the steps taken by the U.S. Army Corps of Engineers and FEMA to set this hospital up.
We know, unfortunately, that this epidemic is going to grow to the furthest corners of the state of Washington. and we have to be and are committed to building that hospital and associated capacity in every single part of the state.
This here's new video of a military briefing just outside of CenturyLink today. And the 300 soldiers flew in from Colorado last week, and Mayor Jenny Durkan said that that team will be staying in and around Seattle while they're in town supporting local health professionals, and we are so grateful for their help in this fight. Today, King County opened up a former Issaquah hotel as a place for people who need somewhere to isolate or to quarantine themselves. The facility joins two other county sites, a former motel in Kent and modular units in North Seattle, already being used for quarantine or isolation. Now, we're told these facilities have 24-hour security and that the people there will be monitored by medical personnel. Meals will also be provided. With April 1st just days away, the two questions on lots of renters' minds are, do I have to pay rent? And what if I can't? Well, there are some differences between the state stance on rent and the city of Seattle. So let's break it down. In Seattle city limits, there's a 60-day moratorium on residential evictions, while the rest of the state sees a 30-day moratorium. But no matter where you are, your landlord cannot immediately evict you if you do not pay rent this month. In Seattle, landlords cannot charge late fees if you miss your payment, but the governor's order says nothing about stopping late fees elsewhere in Washington. So landlords could actually demand back pay once the order ends on April 17th. So something to keep in mind before the 1st. Schools may be closed right now because of the coronavirus outbreak, but beginning tomorrow, classes will be in session just virtually. So at-home learning for all Washington students begins tomorrow. School districts have been working with teachers for the past week to figure out how they'll be teaching their students remotely. And while this is uncharted territory, most teachers are optimistic that this can be done.
A lot of anxiety, but also a lot of positivity. I think that as a nation, teachers have just continued to rise to the occasion and provide what we need for our students.
Online learning is just one of the tools being used here. Teachers have also put together packets for students who may not have internet at home. Private and public schools are closed through at least April 24th.
Well. I guess I have to comment on some of that, don't I? Get up off your butt, Troy. Get in there and do your job. Do your duty right now. Yes, sir. Whoops, excuse me, wrong hand. Start with the eviction thing. Okay, in different states, different things. Even there, that was the slimmest candy coating I've heard of it, okay? Bottom line is 60 days supposedly city, 30 days outside the city, and some cases or some places they can still charge you late fees. Bullshit. Sorry, I said the S word. That's wine. BS. Sorry, guys. Bad word. Okay. You just waive it. They waive it. And then they agree to pick it up with the state and the feds, whatever. I found out today, supposedly the feds, it's like Obamacare. They're handing the cash out to the states, and the states are going to give this money out, or some weird crap, or something. And I put this to you guys. This goes for all states. I don't know. In different countries, there's different things going on, of course. With the way they're instituting the money, once they called it an emergency situation, there was state funds that were available, and in our wonderful Oregon, Little Miss Brain Governor Kate has been sitting on her hands and not helping the people at all, as far as handing out extra SNAP food stamps or cash, which I asked for the 500 cash and 500 food stamps to be given out. Well, I heard that they got some kind of monies, I presume out of the 2.2 trillion already to the state, that bam, it's here or something like that, or it's going to be here but this week, and she could even take it out of that now. But will she? It's 2 cents worth. Now, another thing is with the gas prices and everything, I'd say all the states forgo gas taxes and all states forgo any kind of taxing at this point. And let's drop gas to $1 across the United States. We already know barrels are dirt cheap. Come on, guys. Why do when barrels go up, we get charged and our gas goes up, but when it goes down, you notice we don't get that kind of thing? And I know there's 2 states back east that had under $1 gas, which is pretty awesome. But there's so much more our governors could be doing for us all right now. A lot of people don't have anything, and they're in their homes with very little. And they didn't have the money to go prep or to go get, still don't have the monies. And then they're worried about the rents, they're worried about utilities, they're worried about their mortgages, they're worried about credit cards, they're worried about all this stuff. All that should be wiped out. Out of $2.2 trillion, the base could forego 6 months on everybody and not even get hurt. Yeah, but the greed. And I'm sick of the greed right now. When this is the time to step up and take care of the American people. And I feel like they're dropping the ball, guys. They're treating us like, as one person said, she was like on it, they're deplorables. Those damn Walmart shoppers, they're good for nothing. They don't deserve a thing. They're trash. They're hillbillies. Yeah, maybe we are. But guess what? We're good people. And we're really not. Between you and I, it's those kind of people that are trash. And I hate to throw it back their way, but it's true. And then I'll say it one last time. The men and women that are left behind, we've heard it on how many speeches from Mr. T? The men and women left behind. Well, a lot of us are the men and women left behind. And I'm not happy about it. I'm going to keep reminding everybody and everything all the way we go through this. And you should every day too, guys. And don't say it like, yeah, I guess we're like the men and women left behind. No, we're the men and women left behind. We were told that we were going to be taken care of, and we're not. We're getting abandoned. The other one is, guess we're deplorables. Yeah, we were called that by that person, but really we're not. They are deplorables. You like that? Because that's how it should be. Team 99, we're awesome. And if you're not part of Team 99, you are if you want to be. Join in. If you want to remain on your own and just watch the broadcast, feel free. This is Healthcare Sucks, where we don't candy code it. We use the Fair Use Act. And everything's an illusion until it isn't. It sounds like it's not an illusion for a lot of people right now. So with that, not much video. We'll do more. Over and out. And Healthcare Sucks. See, I didn't say I'll be back, did I? But I will.